HIPAA compliance in the cloud. If you're thinking about using the public cloud in order to build a HIPAA compliant application, don't bother. Can't be done, not worth trying, move along. Amazon has released several white papers saying that you can do HIPAA compliance on EC2 if you follow their best practices. The problem with the best practices implementation guide that Amazon put out is that it isn't actually tested, in that no one has gone through a HIPAA compliance check in order to make sure that they would in fact pass, and there hasn't been a quote-unquote disaster yet in order to figure out whether or not it would limit the liability of the people hosting that application. Unless you want to be the first person to test that out, it's probably not worth the potential savings of building on EC2. In a talk I recently had with Google, they basically said that Google App Engine is not built for HIPAA compliance, and that it wouldn't likely be because of the requirements that Google would have to put into their applications in order to make that work. This is a surprising thing to hear from Google, because Google has been building HIPAA compliant applications with their Google medical products. So for them to say that they weren't planning to build HIPAA compliance into App Engine is to me kind of an admission that it can't be done in the public cloud, because if somebody was going to do it, it would likely be Google. The challenge is really in that in order to be HIPAA compliant, all of the employees that have access to the data have to meet the HIPAA screening rules. Well, if your data is living in the cloud, that would mean that everyone who worked and had access to those servers would have to meet the HIPAA compliance. That can be a real challenge. Amazon addresses this in their best practices by talking about encryption on the servers and making it so that basically tech support couldn't even provide you support in some of the cases where something went wrong. That isn't a good practice to begin with, but it becomes very challenging to make sure that you've actually done everything right, and because of the shared space with other applications, there is the potential for badness to happen. So if you're going to work with HIPAA compliance, you're much better to work in a private cloud or in a managed sub-private cloud. And a managed sub-private cloud is basically taking your servers, putting them in a cage at a co-location facility, and setting it up so that you are outsourcing the power and the network connectivity and all of those features into a managed environment. But the servers themselves are your own, and the only people that have access to them are people who are your own. This is, again, not quite as cloud-like as I think it needs to be to meet the cloud definition, but a lot of people are using cloud in that term, so I'm going to roll with it and say that is a possible solution. But the typical public cloud solutions won't work for HIPAA compliance.